I was diagnosed with idiopathic pulmonary fibrosis. This is a progressive, irreversible, deadly, and ultimately fatal disease. So you change your perspective on life. You have to work with your family and talk about things that are taboo, making a will, knowing what you're going to do with your kids, and to say the least, place a lot of anxiety and stress in your life. I continue to work. I am a family practice physician. I recently retired. And for me, continue seeing my patients, the carrying an oxygen tank was challenging. You have to see a number of patients during the day, 15, 20 patients a day, round patients, and getting home, finishing your chart, working in your EMR, and smiling and providing care for other patients, knowing that you also needed care. The path to getting a correct diagnosis, especially pulmonary fibrosis, idiopathic pulmonary fibrosis, can be between 9 to 11 months. Mine took around 8 months. So that clearly demonstrates that even in my position, being a physician and knowing the system, still took 8 months. So it's imperative to have an earlier diagnosis. I saw 3 physicians, and 4, including myself. I started thinking that I had developed exercise-induced asthma when I developed a cough. That was my initial symptom. I was a healthy woman in my late 40s, otherwise healthy. And then I was convinced that I had exercise-induced asthma. So I went to see an allergist. The allergist diagnosed me with chronic bronchitis and gave me 30 days worth of antibiotic. I didn't get better. I continued to have the symptoms, and on top of that, I developed later on shortness of breath. So I told myself that I had either developed something was wrong with my heart, or I was totally out of shape. The cardiologist saw me and put me to a full cardio workup, which was completely normal, and he was the one who actually said to see a pulmonologist. When I was diagnosed, there were hardly any resources, not much information, no patient resources. So I found myself alone. There were just a few organizations where I reached out, and I didn't know anybody that had the disease. I was used to diagnose asthma, COPD, the more common pulmonary diseases. When I was diagnosed, there were no therapies available. So I was in this situation, being a physician and being a patient, and I said, I have to do something. So I remember I decided to run another article in a publication that was published by the hospital that I used to work. By doing that, I was trying to raise awareness. I founded and created a support group in the city that I used to live, and that brought other patients that I didn't know that they have the disease. And they all became my patients, and I collaborate and co-treated them with the pulmonologist. And up to this day, I have continued to advocate. I volunteer for an organization called PF Warriors, which is an organization that was founded by a patient. So our intention is to empower and educate patients and caregivers. Becoming a patient after being a physician was a particular experience for me. If anything, makes me more humble, more empathetic with the patients, knowing in the bench that I was now on, receiving orders, receiving advice, being vulnerable, and experiencing side effects of medications, navigating the system, that put me in a different bench, in a different position. I was more aware of why a patient didn't show up to my appointment. Things that I was not aware before came more evident to me after I became a patient myself. The reason that I decided to share my story in this particular setting that reaches so many people that work in the pulmonary field is to make sure that they know the importance that getting a therapy earlier, so we can intervene earlier in the disease process and changing the course of the disease, giving a patient a little bit more life expectancy, more a better prognosis and a better quality of life.